Good afternoon and welcome to the question and answer session on Destination 4 of Cluster 1 of Horizon Europe, ensuring access to innovative, sustainable and high-quality healthcare. My name is Carmen Laplaza and I am the Head of Unit of Health, Innovations and Ecosystems in DG Research and Innovation. And I have the pleasure to be moderating this question and answer session today. I will be assisted by a panel of colleagues who I'm going to introduce you. We have with us Annika Sternquist, Destination 4 leader. We have Orestis Kalliantsidis, who has co-drafted the resilience and mental well-being of health and care workforce topic. And we have also Lorena Korosek from DG Environment, who has co-drafted the topic on environmentally sustainable and climate-neutral healthcare systems. So, Destination 4 is focused in healthcare systems. The main aim of this destination is to provide the knowledge and solutions to contribute to healthcare systems that are more effective, efficient, accessible, sustainable, and resilient, where healthcare providers do have the necessary skills and competencies, and also where patients and citizens are empowered in their own health management. We also include in the context of this destination the needs of vulnerable populations and also of informal carers. In 2023, which will be the focus of this session of question and answers, we are going to fund three topics, three research and innovation actions, each of them with 20 million euros. One will be targeting regular and healthcare services, maintaining the access to regular and healthcare services in case of cross-border emergencies. Second one will be targeting the resilience and mental well-being of the health and care workforce. And last, a topic that will be focusing on the sustainability of healthcare system from an environmental perspective. So we can start with the session of question and answers, and I invite you to introduce your questions in the Slido. Please, to facilitate our task, I would ask you to write the code of the topic before you introduce your question. Let me precise that we will be only tackling those questions on the content of the topics, as questions on cross-cutting issues, horizontal issues, or international cooperation, for example, have been the subject of a session this morning. All right, so I see there are already a few questions on the Slido. The first one is a question that was addressed to two destinations, Destination 2, we answered this morning, and Destination 4. So it's a question that indeed is relevant for both destinations. I think this question is for Orestis, and is asking which of the two topics in Destination 2 and Destination 4, both somehow focusing on the mental well-being of the healthcare workforce, could be, well, not of the healthcare workforce, but of the workforce. So for which of them would be better fit a project using virtual reality for healthcare workers to reduce the burnout?
Thank you, Carmen, and good afternoon to everybody. Indeed, we answered this question in a morning session about Destination 2, and it's worth answering it here. So thanks for submitting it to both. There is a core topic in Destination 2 called Evidence-Based Interventions for the Promotion of Mental and Physical Health in Changing Working Environments. Therefore, it is broader than this topic for the healthcare workforce. Indeed, from this one-line description, it sounds as a good fit that a project idea focused on the health workforce with its particular risks for its resilience, especially after COVID, is probably a better fit for the more focused topic. However, as this one line suggests, the development probably of a solution, it is actually the applicants who have this idea that have to contemplate the scope of this idea compared to the scope of Destination 4. Destination 4 calls for as comprehensive as possible solutions to innovative solutions for health systems resilience, pointing also to management practices, recommendations for policy action, and has the scope of the attractiveness of the profession as well. I think you know better what the challenge is and what the idea you want to apply. So exercise your judgment. We can't judge the admissibility of such an idea in this session, and see where it applies better. I think it is worth mentioning here for applicants once more that double submissions are not allowed, so a choice will have to be made.
Thank you, Orestis. So we have another question that it's on the topic of environmentally sustainable healthcare systems. So it's for you, Lorena, and it's asking whether infrastructure, the term infrastructure is used in the guidance, does relate to building specifically or to organizational systems?
Yes, thank you very much for the question. Indeed, the topic encourages the candidates to take into account the technical guidance on the climate proofing of infrastructure in the period 21-27. So climate proofing is a process that integrates climate change mitigation and adaptation measures into the development of infrastructure projects. And as already correctly indicated in the question, the definition of infrastructure is here broader and does not include only buildings, the building stock. So it also covers organizational systems such as weight systems, networks, transport, energy networks, infrastructure, infrastructure in relation to communication and information. Also nature-based infrastructure. And these are all so-called organizational systems, which should also be taken into account in proposals. Because if we look at the scope of this topic, we can see that it's not merely focusing on buildings and building stock, but also products, processes, supply chains related to health.
Thanks, Lorena. Indeed, there are different topics in Horizon Europe that are targeting the sustainability from an environmental perspective, but indeed this topic needs to focus obviously on healthcare systems and healthcare specifics. Let's move to another question on the first topic, which is about maintaining access to healthcare to regular healthcare in case of cross-border emergencies. So it's asking, does it have to be about COVID? Annika.
Thank you, Carmen. No, this topic does not prescribe that proposals have to be about COVID. It's more about COVID we've used more as sort of setting the context. It's similar for several of the topics in Destination 4 and probably other destinations as well, that we've seen that there are problems in the health and care systems that were there already before the pandemic, but because of the pandemic, they've been more visible and they've been, in many cases, aggravated because of the pandemic. So no, the proposals do not have to be about COVID. Also, if you look at the bullet points in the scope section, we mention epidemics response measures, for example, but we do not say that it has to be about COVID, so it could be other epidemics. And also It does not even need to be about epidemics, but other types of emergency situations. So I hope that was clear. Thank you.
Thank you, Annika. I think it was clear. So let's move to the following question on the second topic. So for you, Orestes, the question is asking whether projects, because the topic states that projects should avoid overlaps with ongoing calls or actions. It would be useful for the audience if you could specify which calls of action should or could be considered.
Thank you, Carmen. I would also think that it is worth checking for synergies as well, but certainly avoid overlaps. So when drafting this, we were thinking of, for example, Horizon Europe call about boosting mental health in Europe in times of change. At the time, I am not entirely sure we could point to particular actions selected, but there could be ones, or for me to, I do remember an H2020 project called Empower, which created a European platform to promote well-being and health in the workplace. These are examples that one, by doing research as an applicant, would see what the state of the art is. It is part of that research, I think, when preparing an application, and avoid redoing work similar to that. I think it is also worth mentioning that there is a partnership on transforming healthcare systems. You are much of an expert in that, so correct me if I get the title wrong. So it is also worth being inspired of what the scope of this partnership is, and what the challenges will be addressed there.
Thank you, Orestes. Indeed, you made reference to a co-fund partnership that very recently started, actually at the beginning of this year, on the transformation of healthcare systems. And of course, their work is very relevant to most of the topics that will be funded under Destination 4. So it is very useful indeed to check what they are doing. They will presently be also funding calls to look at the different documents published by this co-fund. But more in general, I think that the need to ensure synergies is very important, not only for those topics, but of also it's important that when you are preparing a proposal, you try to build on actions that are already ongoing, and you do some search about them. So let's move to the next question, which is on the third topic, on the environmentally sustainable and climate neutral healthcare systems. And the question is asking whether sustainable pharmaceutical development can be included in the topic, would be in the scope of the topic. So in concrete, would the development of pharmaceuticals be included or considered as the scope of health of this topic? Lorena, could you please provide the answer to this question?
Yes, thank you for the question. Regarding the scope, the only requirement, let's say, in regard to this question, is also to take into consideration the existing ongoing projects in relation to green pharmaceuticals under the European the Green Deal call, but otherwise sustainability of medical products, of pharmaceuticals is not excluded, but perhaps Annika would have a more concrete answer to this one.
Thank you, Lorena. Yeah, maybe just to provide a bit of the context, that we had a call in a previous work program just last year, I think, about precisely that, green pharmaceuticals. And also this destination is not about, at least not 100% focus on development of things such as medical tools or pharmaceuticals, etc. So it depends a bit on the exact project, I would say. But if what you're asking, if a project that is 100% focused on developing pharmaceuticals, I would say it's not in the scope.
So thank you to both. Actually, in the context of Destination 6 in 2021, we funded a few projects precisely targeting the development of green pharmaceuticals, and maybe that's the topic that Lorena was referring at. I think that it is very important to look at what is expected as expected outcomes from a topic, and then it's up to you to decide whether you think it's relevant. But in principle, I agree that it's not the main focus of the topic. Another question, also targeting this topic, is asking about the assessment of ongoing reforms in different countries would be considered under this call. Annika, Lorena, I don't know who of you would like to answer to this question.
I can maybe start. So now, just assuming that PHC stands for primary healthcare, maybe it's something else. But if this is what it's about, I mean, yes, I would assume that this could be considered under this call. Yeah.
Yes, maybe it would be interesting if Maya, who asked this question, can maybe precise a little bit more about what she means by the PHC reforms. So in the meantime, I think there is another question asked by Maya, so I will read it. It's also on the same topic. Thanks a lot for your proactive participation, by the way. So does this call support intervention development and implementation itself, or should interventions be in place already funded? Annika, Lorena?
I'm trying to understand the question. Does this call support intervention development?
While you think about it, maybe I can mention that, of course, many of the questions that you are asking today will be can be complemented by us in writing in the frequently asked questions, and I think that's what we will do with some of these questions. But in the meantime, it's good to precise a little bit more what is behind. It's not always straightforward for us to understand what you have in mind when you are asking the question. So Annika, Lorena, do you see more clear whether the intervention, development and implementation itself, in principle, implementation itself, it's not really the focus of what we do with research and innovation funds. But of course, intervention development, in principle, it would be activities that could be supported. But I don't know whether in the specific content of this topic that could make sense.
Yes, I think it's not. We don't need to exclude any of these because because in this topic we are asking for more knowledge, for more solutions in relation to environmental, so how to also reduce the environmental impacts. So it's about existing processes, existing approaches and methods and products used, but also to understand better what is the impact, because there is still a research gap, knowledge gap in this field. But on the other hand, to also stimulate new solutions to see how we can address these gaps. I'm not sure if this answers the question, but I think depending on what specifically it is meant, I think it can include both aspects.
Thank you, Lorena. Next question is well, actually, next question it's not on one of the topics that we are going to discuss today. I don't recognize the code 81.
So Carmen, I can maybe Sorry.
Yeah?
Yes,
please,
this
Annika.
is about the partnership. Sorry,
Okay.
this is the code for the partnership that we're not that is not in focus today.
Indeed, we are
but
only
maybe
discussing research and innovation actions. Yes, this is EcoFund. It's not the target of the 3 topics that we are discussing today. As I said at the beginning, we are focusing on the research and innovation actions of Destination 4 in 2023. Let's go to the next question, which is on the first topic, maintaining access to regular health and care services in case of cross-border emergencies. And the question is about how many years may a project cover? And I don't think we can provide a number because that would depend on the specific content of the activities proposed in a concrete proposal. So that's up to you. You are the best place to decide how many years would you need to process to go ahead with the research and innovation activities proposed. But I don't know whether you, Annika, want to complement the answer to this question on the number of years.
No, I agree. I wasn't sure if this question was about the study focus of the project, so to say, or the length of the actual project. But yeah, I mean, either way, it's if it's about a project, you can find this in the general annexes, how projects are supposed to be planned and shaped. But if it's more about the scope, then no, I agree. We cannot really say here. It's up to you what is relevant to study. So if you have an idea for a long-term study, that's
obviously then it will be up to you also to justify the timing necessary as well as the resources, and that's what the evaluators will judge. I propose we move to the following one, which is on the third topic, sustainability of environmental sustainability of healthcare systems, and is asking whether will this topic, I assume, include sustainability of clinical pathways or models of care. This would include engagement of healthcare professionals. Lorena, I suspect the answer is yes, but I prefer you to confirm.
Yes, thank you. No, I agree. The aim of this topic is also to include to make sure that decision makers, policy makers, but also health and care workers are included in the process. So I would say yes as an answer.
All right, so I see now a question on the second topic for you, Orestes, asking whether proposals should be addressed only, so proposals addressed only to care at home are eligible, or is the topic funding proposals at clinical care, hospital or primary care too?
Thank you, Carmen. I think short answer is yes, but maybe I should elaborate a bit on that. So by reading the call text, I think one understands the value of comparing data for different work profiles within the health workforce, or for evidence about different settings. And that is something we would like to capture, and we hope we have proposals to capture this diversity and compare also. However, this doesn't mean that we recognize all settings and all working profiles as the same. There is a big difference between doctors and informal carers. Therefore, we are also interested in topics which would target a specific target group. Of course, not knowing the exact idea, applicants would have to build their case on why they are targeting that particular setting or worker group, and of course make sure that within their idea they do respect our request that they cover several of the listed activities in the call text and several of the most expected outcomes. So that would be maybe a more elaborate question in my initial yes.
Thank you, Orestes. Next question is again on the environmental sustainability. I'm really glad to see so much interest about this topic. So would there be a room for a series of innovative technologies that reduce electricity consumption in hospitals and therefore reduce carbon dioxide emissions? Lorena, what do you think, or Annika?
I can start. I think, yes, it could include such innovative technologies, but taking into account that this is something really healthcare or hospital specific that is relevant for such premises, because as underlined also in the scope, the activities that are targeted in this topic have to be related to specifically to health sector. I'm not sure if we can add on that, if Annika has additional point on that.
I can just add very quickly to repeat again what was said for a previous question, that I mean, as long as it's not 100% about developing a technology, then I agree that it's in scope if it's really relevant for healthcare, that it's also about how it's used in the specific context, etc.
Thank you to both. So we keep on talking about environmental sustainability, and now, so Maya has re-asked the question about whether the assessment of interventions or reform, which already exists, would be considered as in the scope of the proposals.
Sorry, okay, so the assessment of interventions or reforms which already exist are considered. Yeah, I would say so. Let's see if Lorena agrees.
Yes, I don't see any problem with that. I'm not sure if there is any specific unclarity related in the topic, but yes, I agree. I think I don't have any specific issue with that. I think this is included, yes.
I think this is a question that maybe we will come back also in writing in the context of the frequently asked questions, because the assessment of reforms could be part of the scope of a proposal. I'm not sure whether only that would qualify to consider a proposal for funding. So, and I am saying that not confirming or denying anything, it's just that I think we will come back by written on this question in the coming days. And therefore, I remind you that you always have the possibility to introduce more questions in the coming days or weeks through the participant portal that we will answer and include in the frequently asked questions. Also, if any of the answers that we provided was not clear or we didn't understand completely, of course, feel free to reintroduce also in the participant portal. So having said that, I go back to the questions that are now popping up, and I see a question for Orestes on the mental and well-being of the healthcare workforce. Is asking about what is the expected TRL output? Would a multifaceted proposal tackling different problem solutions be acceptable? I am not sure we are going to precise what would be the expected TRL. I don't think so, but Orestes, please feel free.
Thank you, Carmen. I think you answered it already for me, but I'm going to do something dry. I'm going to read out something, but I think in this case it's important. So in the general annexes of the work program, there is a definition of a research and innovation action, and that is what we are doing here. It is only 4 lines, so please bear with me. Activities that aim primarily to establish new knowledge or to explore the feasibility of a new or improved technology, product, process, service, or solution. This may include basic and applied research, technology development and integration, testing, demonstration and validation of a small-scale prototype in a laboratory or simulated environment. And I think that points slightly to what is the upper side of the TRL that an action might reach. In the general annexes, one can also find our own definitions of the TRL, but I don't think that in this case we are going to set an upper TRL for that. I think the applicants are perfectly capable to consider their solution and see if it matches those and up to which point. I think there's a second segment on this question about the multifaceted solutions and potentially addressing various problems, if I understand it well. Here, not knowing anything about the potential problems or solutions envisaged in the potential proposal, I would say yes, in principle, the topic welcomes that. Of course, it depends on your idea.
Thank you, Orestes. Next question, and is the last that I see for the time being, is addressing the topic of the healthcare system's environmental sustainability, and is asking whether hospital energy efficient projects would be in the scope of the topic. Lorena, do you want to answer to that question, or Annika?
Yes, similar to the previous question and answer, this is also in the scope, so we have, I think, quite clearly put out spelled out the energy and energy demand in hospitals, but again, it's not something specific for. It should not be something general, but specific for hospitals, health and care systems, so health sector in general.
Thank you for precisely, Lorena. Indeed, very important. The specificities of healthcare systems or healthcare facilities. I do not see any other question in the Slido. I repeat that please feel free to ask us a question in the coming days or weeks. If no other questions pop up, maybe I will just start the conclusion of the session by thanking you for your active participation and for all your interest in Destination 4, to thank you, the panel, for being there and answering the questions. They will still be there, as I said, in the coming days and weeks to answer by written. And I will wish you the best of the success in the application to our topics. And I remind you that the next session will start at 15:20, targeting Destination 5 of Cluster 1. Thanks a lot.